I am Felice Bombacci. I am the responsible of CML patient group, Italian CML patient group, and I am with my friend Dott.ssa Abruzzese. She is a best hematology in Italy, one of the best hematology in Italy, and she is very expert not only with CML but especially for CML and pregnancy and conceptions. I have for you some question I received by a patient in our forum, and I would like to ask to you, for example, one question is, I have a CML but I want to have a baby. Can I plan a pregnancy? What will happen with my treatment before, during and after pregnancy?
Okay. Hello everybody. Yes, you can plan a pregnancy. What will happen with the treatment before is not absolutely necessary to stop the treatment. During is absolutely necessary to stop the treatment since the discovery of the pregnancy until at least the first 12 weeks, because this is the period when the organs develops and the TKIs can interfere with the organ formation of the baby. And after the pregnancy, if you have stopped and you succeed to have the pregnancy, you may restart the same treatment after you achieve the birth. And if you need to restart the treatment, meaning that your response is that you lose the major molecular response, and you can establish this with your hematologist.
Another question is it a risk for me and or for my baby? What do your recent research say? What are the data published, if data are available now, or if there are a record of pregnancy or conception for the CML patient?
There are many recent data published, and some are about to be published. There are two main registries. One is in Italy, and it accounts for about 200 pregnancies or conceptions, and the other is international and accounts for about 500 pregnancies and conceptions. And all those data, they refer to 3 points: the risk for the mother with CML, the risk for the baby, and the outcome of the babies. And synthetically, I can say that if you are in a good molecular response and your pregnancy is planned, there are not many risks for you to stop the treatment and that your illness get worse. For the baby, it's important that you don't do the treatment during those first 3 months of period. And the baby that are born after pregnancy in a CML patient, there are no differences with the other babies.
I have CML and with my wife we are planning to have a baby. It's possible? What risk can I be taking during conception?
It's important to say that the TKIs are not genotoxic. It means that they don't interfere with the eggs and the spermatozoids, but they interfere with the organ formation. So they are teratogenic and embryotoxic. So the problem is mainly for the woman that has CML and is in treatment. We can say that there are no problem in a man during treatment to plan and to succeed in conception.
And for women, is it necessary to increase the number of control for CML during the pregnancy?
Usually, since you have to stop the treatment, we treat the pregnant woman exactly as someone that is doing a treatment-free remission, meaning that the exams, the molecular biology is carried every month. In the first 3 to 4 months, then if the transcript is stable, you can also delay a little bit to 45 days, 50 days, but I wouldn't go farther than that.
When I give birth, do I have to do a cesarean section, or could I give birth naturally? Are there any contraindication in doing an epidural?
There are no contraindication in doing epidural, and also no contraindication in giving natural birth. The reason of doing a cesarean section are just related to the OBGYN, and it will not concern the CML. So don't think about CML if you have to give birth. You're like the other babies, the other patients.
It's possible to breastfeed the baby?
Of course, it's possible to breastfeed the baby as far as the woman is still not taking drugs for CML, the TKIs. Because TKIs, they pass through the milk, and even if the dosage is very little, is not something that we want to risk with the baby. And something that I want to add is that CML cannot be transmitted through the placenta or through the milk, so there is no possibility that the baby has a passing the CML during the pregnancy and the delivery and so on.
If a patient, a CML patient, discovered accidentally to is pregnant, what should she do?
Okay, this is a difficult question because when someone discovers being pregnant during CML treatment, it usually don't know at which point of the pregnancy she is. So the first thing is important to know how long and to what drug the baby has been exposed. And if it has been exposed during the 5th and the 12th week of gestation, when the organs are formed, there can be a risk. This means that you should stop the pregnancy? No, this doesn't mean that you should absolutely stop pregnancy, because only 30% of the babies can have problems. But this means that if you don't want to stop the pregnancy and you want to carry on this status, you have to strictly follow up the patient in conjunction with the OBGYN to run some additional testing and a very accurate scanning of the development of the baby.
Summarize, dear Professor Elisabetta, if possible for me, summarize what you said. Green lights for male and yellow and green lights for female.
Exactly. Always refer to your doctor or refer to some center that is used to take care of patients with CML, that has a team that work together for managing those patients. Because the back to the future of a CML patient is possible, and now also for pregnancy.
Thank you so much, Elisabetta, for your kind availability and for your professionalism, for your dedication to patient, for give a desire to have a pregnancy, to have a baby.
It was my pleasure, and thank you very much for inviting me.